Welcome back to Alpha Physio Pelvic Care, all things pelvic health. My name is Anastasia Varova. I'm pelvic floor physiotherapist with over 10 years experience in pelvic health with female, male and children, and I reside here in sunny Cyprus where I also practice pelvic floor physiotherapy. Today we are talking menopause. We're talking menopause and we're talking pelvic floor exercise menopause and specifically where to start. Where to start? It's so overwhelming. You're getting into perimenopause stage, getting into menopause stage, maybe you're already postmenopause stage, and you right now discovering all this pelvic health and what does it mean and what does it mean for you and what's the implication, or maybe you already have some symptoms, maybe you have the urgency, maybe you have the leaks, maybe you have pain with intimacy, maybe, and so many things. So today I will just put your mind at ease and I will show you 3 exercises specifically tailored to menopause, specifically tailored, and you will see why in a bit. But before we start, make sure you press like right now at this video, and also don't forget to subscribe. It really helps me to grow, it really motivates me, and really brings me joy to create content for you. In menopause, there are a few things that are important when we talk about pelvic health. First of all, strength and preservation of the muscle mass, of the area close to pelvic floor, so in the close proximity, such as your inner thigh muscles, such as your gluteal muscles and pelvic floor, of course, itself. Number 2, mobility. Things are getting a bit stiffer in menopause. It applies to the joint. You know, this joint stiffness, joint pain, could be some knee stiffness. Generally, stiffness can be the thing. So, mobility, number 2. And number 3, the blood flow. As estrogen level drops, it can also affect our blood flow. You know, feeling a bit colder, a little bit colder, more colder hands, colder feet. So we want to get that blood flowing also in our pelvic area in order to support it better, to nurture the tissues, the epithelium inside the vagina and around the vulva and all that area. We make sure the blood flow is getting on there properly, as well as lymphatic drainage, because lymph, a substance that removes all, let's say, waste and toxic products from our body, and then we get it out either with a pee, with a sweat. But the thing about the lymph is it doesn't have its own pumping system like does the blood vessel system. So we need to move in order for lymph to help. And because there are so many lymph nodes around your pelvic area, we really need to be on top of draining the area effectively and making sure nothing gets stuck. I prepared 3 exercises that will work just on that: strength, mobility, and lymph and blood flow. Let's begin. Number 1 is the strength. I have here 2 dumbbells and they're 1 kilo each. I would suggest for you to start small and then you can progress, especially that we are going to use these dumbbells on our pelvic area. And you will need to place it here, right? So with 1 kilo, it's fairly easy. I'm placing it here, right here on my hips. I can hold them and it's fine. But bigger dumbbells will require probably a cushion, or you will have to get a special belt where you can put the dumbbells on the side. I would not suggest more than 6 kilos. You don't really need more than that unless you're a professional lifter, heavyweight lifter, then you can do it according to your program. But if you're like first timer, no idea what's happening, let's start it easy and let's not overwhelm ourselves. Dumbbells on your hips, just holding them slightly. They don't provide a lot of pressure here. And I'm taking nice deep breath in into my sides and in the back of my ribs. Breathing out and coming up. And squeezing my glutes. I'm slightly holding the dumbbells so they don't fall, but so I still can feel some weight. Breathing in and relax. Breathe out. As you go up, think about the area around your anus, With every breath in, you relax and let it open. And with every breath out, you squeeze like you try to hold the air off from escaping. Simply speaking, hold the fart. This is the lexicology. This is the words I use with my clients, and it's usually very effective. And breathing out and breathe in. Very nice. So we can repeat this for about 20 times, breathing in and breathing out. Doing this exercise on purpose. Number one, it's easy. Easy to remember. And you know, a memory can be a bit of a challenge during menopause stages. Number two, it's easy to find the weight to place in this area. It doesn't have to be special weight. Number three, it works very well, your hip extension. And these muscles are quite tight. We're all sitting these days, yeah? More than we should, but we all do. I even do, and I'm a physiotherapist, and I still sit quite a bit. All right? We are exercising our glutes. We are mobilizing our spine. Okay? We are bringing our organs downwards. We're lifting our pelvis higher than our chest, so we create that kind of downwards pull of our organs in case you have a predisposition for pelvic organ prolapse. As I was talking, I did probably 100 reps, but we stick to 20 repetitions and we are good here to go. We did our strength. Now we need to do our hip mobility. Just a little caution, if you did happen to have hip replacement, all right, I would not suggest to do these exercises, this next one. However, I have a separate video that is designed specifically for that. Pelvic floor for hip replacement, and there are plenty of safe exercises you can do. This one, in case you had a hip replacement, I would not recommend, and you can head into my other video about pelvic floor exercises and hip replacement. Otherwise, we're sitting here leaning onto our hand, and we're going to breathe in and let your left knee, I'm just going to turn here, rotate in. I'm not expecting everyone having the same range of motion, all right? Breathing in and breathe out. Breathe in, relax. Breathe out. You can do your pelvic floor engagement on the breath out, so the squeeze. Breathe in. If it goes only to here, that's fine. The most important thing, when you do your rotation, the other leg stays straight, so it doesn't go there. Not for now. We're gonna do it later, but for now, only this. Breathe in. Breathe in. And you just move it there and repeat it about 6-7 times each hip. And after it's done, feet together and we roll, breathing in, breathe out, come back, breathe in, breathe out, come back, breathe in and out, come back. Again, 5-6 reps on each side. Okay, we did our strength, we did our mobility, and now we're going to do our blood flow. For the blood flow, you can either do a simple jumps. They are now called dopamine jumps. Very fancy thing that going around, the fancy trend that goes around the internet, which is fine. So it's usually people jumping side to side. I do find that my menopausal, perimenopausal clients are not up to jumps, especially if you do already have leaks. You don't really want to jump and have more leaks. So I would suggest to have a chair, okay? You lean on the chair, you relax your knees. That's a very important bit, okay? And now we're going to do, as I call it in my classes, Shakira dances. Trademark, copyrights all goes to Shakira. Okay, so we bend our knees, and here we simply start to shake our bottom, shaking your booty, going a little bit forward and a little bit back. Now, it's not a high performance dance on stage. There is no right or wrong, okay? I have people, they kind of struggle to do the shake. That is also fine. As soon as you do a little bit of shake, okay, let your muscles shake and keep breathing. You shake. You can shake your knees if you prefer, okay? You can shake your knees, or you can shake side to side here. I'm shaking here now my pelvis, or you can shake your knees. Or you can just find yourself a nice belly dance video and follow it through. Belly dance is just amazing for the pelvic floor blood flow, okay? And going forward and back, forward and back. In this position, your bladder is less compromised. Your pelvic organs are less compromised. You're just supported here, and also you can distribute the weight between your knees. However, if you prefer to do it in standing, you can do it a little bit in standing. You can jump up and down. So really, a shake, okay? There is no right and wrong. And you can do it for a minute or two, and that will be it. As soon as you're not leaking, because even with a smaller shake you're leaking, that really calls for the visit to pelvic floor physiotherapy. Otherwise, a little shake, bend your knees forward and back. You can lean onto the wall, you can lean onto the chair whilst your coffee is boiling. A little bit of shake, keep breathing, and we are done. So we did our strength, we did our mobility, we did our blood flow and lymphatic flow. And if you make it yourself a habit, especially during period of perimenopause and menopause, that will be just great. Just first step to better pelvic health, to feeling more energized, to feel stronger in your pelvic floor. Try to stick to this routine for at least 21 days to see the difference, yeah, daily for 21 days. And let me know if you tried any of them. Let me know if any of them were difficult, or maybe you already have your routine, or maybe you have your favorite exercise, or anything that helped you feel better during perimenopause, menopause, postmenopause period with your pelvic floor. Let me know in the comments. I would really, really appreciate it if you let me know. Thank you so much for watching this video, and we will see you back very, very soon. Bye bye.